My name is Dr. Kerry Gelb, the host of Open Your Eyes, the documentary. Today I have Dr. Derrick DeSilva with me, who was in the film and one of the stars of a film. The COVID virus 19 is in 177 countries and territories. It's affecting over 350,000 people worldwide. Today we're going to talk about antiviral nutrition and strategies, not necessarily direct at COVID-19 because there's not a lot of research on that, but there are things we could do to protect ourselves against viruses. Currently, there are more than 80 clinical trials underway to see what we could do to have strategies against COVID-19. We are testing remedies around the world with such things as IV vitamin C, stem cells, HIV drugs, anti-malaria drugs. There's also research on vitamin D and quercetin. Dr. DeSilva, who happens to be a friend, a very good and close friend, he's an internist in Edison, New Jersey. He's been an internist for over 31 years. He's on staff at Raritan Bay Medical Center in Perth Amboy. He's a teaching physician at JFK Medical Center in Edison. He's the past chairman of the Age Management Medicine Group, AMMG, which is like a tongue twister for me. He's the past president of the American Nutraceutical Association. He's won a number of awards, including the Best Doctor for the past 19 years by Castle Connolly. He's our medical correspondent for our local TV, New Jersey News 12, and I love his Health Matters, his little 5-minute segment or so that he does during that show. In fact, I've been a guest, and I've been very honored to be a guest on that. He's formulated over 350 dietary supplements. He's an author. I could go on, but I don't want to waste all his time. And I want to thank you, Dr. DeSilva, for joining me.
Thank you very much, Dr. Gelb, as always, for the invitation to be with you.
You know, during our film, when we recorded you for Open Your Eyes, you really brought the house down. When you speak, everybody's on the edge of their seat. I don't know if it's a gift, if you study how to speak, but how do you do that to make what you say so interesting?
It's my mother's fault. You know, when I was, believe it or not, I was probably about 9 years old. And my mother said to me, your mouth is going to be your gift and it's going to be your downfall. So I'm going to teach you how to speak. And she sent me to elocution classes when I was a very, very young child. So I don't know if that's what it is, but my mom recognized it. And that's where we are today.
You know, you've been a speaker for my Old Docs group. You've given 3-hour lectures, and people are on the edge of the seat on the last 5 minutes of the 3 hours. So I really have to congratulate you. You know how to put things in a way that makes it a very complicated topics to make it simple.
Thank you.
So I just want to thank you for that, for being such a good educator and educating me and my group. Let's start off with something very simple. What is a virus? We hear so much about viruses. I don't think the public even knows what a virus is.
Well, a virus is, and you know, this is very interesting. You know, the way bacteria, molds, viruses, they all work and react and respond differently. Do you know, believe it or not, I don't know if you're aware of this, the audience may not be aware of this, but the bats carry and harbor thousands of viruses on themselves and never get sick. There's been a lot of virologists, scientists who study viruses, that have been studying bats to find out what is it about bats that they don't get sick, but they carry all these viruses. This particular virus that we have, and most viruses, by the way, are parasitic. They need the human body in order to live and to survive. This particular virus, the COVID-19 virus, is what is called an RNA virus. So it replicates and it depends on the body in order to replicate and do all the damage that it really does.
So is this a single virus, or is it more than one virus put together?
Well, from what I understand, the group of COVID viruses is a group. You know, there's various types of influenza A, various types of influenza B, and there are, I believe, between 4 and 5 different types of COVID viruses. This particular virus was, and the reason it's called COVID-19 is that it was quote unquote discovered or founded in 2019. And what's been so unique about this is that they're calling it the novel COVID-19 virus because it's a new virus. Within this category, they've found this new family member that was hidden or has been in hibernation or been away for centuries, and all of a sudden shows up. So they don't really understand, was it a mutation? Where did it come from? And that's where all the quote unquote fear within the medical community is that they just don't know what the virility, meaning how potent this thing really is. And that's why they're taking so many precautions and they're being so overtly cautious.
So COVID-19 is a disease, but SARS-2 is the virus. And if you could explain the difference, because it's very confusing.
Well, the coronavirus is the COVID-19 is the name of the disease. It's not the name of the virus, if you will. There are certain viruses and there are certain diseases, you know, H1N1, and all of these viruses, they're named accordingly. So what we have to do is we have to look at this and say, you know, the way I approach this, Dr. Gelb, is this. What I tell my patients is, look, we have certain diseases, we have certain viruses, we have certain things that are out there. The bottom line is that be aware and be careful out there. And we're going to get into a little bit of prevention a little bit later. But all of these things are just, you know, to me, simple. For the public, get very complicated. And I like to bring this down to a level of, listen, just do the basics. You know, I go back to what you were taught in kindergarten. You know, I heard, and I'll come back to this a little bit later. I'm getting a little bit off topic here. Apologize for that. But somebody said to me, you know, if nothing else, I believe it was Dr. Sanjay Gupta on CNN said, wow, I've never seen so many men coming out of the bathroom washing their hands. And I said to myself, seriously? How do you go to the bathroom and not wash your hands? And I say to people, look, before I touch anything down there, I want to wash my hands before and I want to wash my hands after. Think about that. Think about that. I'm in the airport. You know how much I travel. I'm in the airport. You know, I've probably done 50,000 miles this year in the air already, which I've stopped, by the way. But when I'm in the airport, I'm going through security. I'm, you know, handling my bags. I'm touching things in the airport, the railings, etc. Before I use the restroom, I want to wash my hands before I touch my private parts, but also afterwards. It's, for me, more important to wash before and after, and getting back to the basics. So I'm sorry I got off the topic there for a second, but I just wanted to make sure I didn't forget to say that.
No, talking about washing your hands, talk to me about soap. Is soap enough? Do we need alcohol? Do we need tricycline? What do we need to clean our hands with? And how should we dry our hands?
For many years, people have done, this is every single flu season. there's a study comparing soap and water to all of the hand sanitizers and things like that out there. Across the board, it has always come out that using soap and water is best. Here's why. When you use soap, and you remember all of the oil spills and things like that that have been out there, what do they use to clean the oil off these birds to save them? They use soap. Why? Because the soap is called a saponification or a saponifying agent. What soap does is that it breaks up the fat, and the viruses have a fatty layer or a fatty coat around them. That is why soap and water is the best thing when it comes to breaking that fatty outer coating of the viruses and destroying the virus. You don't need to use hand sanitizers and alcohol. Now, if you're at the airport or if you're out in the public and you need to do a quick rinse, okay, use the hand sanitizer. But again, you don't need to go crazy with that. Wash your hands, use soap and water. And one other thing, Dr. Gelb, that I want to mention that's very important. A lot of people don't know how to wash their hands. And I want you to think about this, by the way. How many of you wash your thumbs? Think about this. You have water dripping down, and how do you wash your hands? You wash your hands like this, right? How many of you wash your thumbs? You don't. The thumbs are a very important piece when it comes to grabbing things, holding things. So also, after you wash your hands, the thumbs are remotely involved. Make sure that you wash your thumbs for about 20 seconds also, because those are your fingers too. So make that part of it. And when you're washing your hands, and I'm going to stand up here for a minute, when you wash your hands, you have the soap and water that is coming down from a faucet. You should be washing your hands downwards. So let the water drip on the top of your hand and drip down. All right. Again, these are all things that people just don't pay attention to, that we need to pay attention to as that water drips down. I remember during our training, when we were in surgery, we had to wash all the way up here. You don't need to do that. You really don't need to do that. But basically from your wrists down is where you need to wash, and don't forget to wash your thumbs.
And you said 20 seconds.
20 seconds. 20 seconds.
So talk about drying your hands.
Another really, really good point. What I typically do is, once you dry your hands, and typically what I do is I will use a paper towel and also dry in between. You have to wash in between and dry in between, and get them as dry as you can. You don't want moisture to linger on your hands, all right? I don't know if you had anything else that you want to add on that as far as drying your hands. Did you have another hint?
Well, I wanted to ask you about the blowers that they have, like in the airport, that are blowing your hands dry as opposed to using a paper towel. If you could make a comment about that.
Here's what I do. I use a combination of the two. Here's why. I will use the blower initially. Okay, now some people reverse that, but the reason I use the blower initially is because I want to get most of the moisture off, and I want to use the paper towel to open the door. Now, if I'm at the airport, and most of the airports don't have doors, right? They have that partition that you go around, etc. If I'm at the airport, I just use the blower, because I don't need to now grab a handle unless I'm specifically going into a bathroom that does have a handle. Then I will always take a paper towel with me to use that to open the door.
Great. Let's go back for a minute. Let's talk about some of the symptoms a viral disease. If you could just mention what kind of symptoms do we get when we're sick and we have a virus? And how do we know if it's something even more serious like the COVID-19 or maybe a regular flu or some other type of virus or a regular run-of-the-mill coronavirus, which is probably 10 to 15% of regular colds that we get during the year?
Right. Differentiation, especially now coming in, depending again also on the time of the year. Here in New Jersey at this time, we're in the very early spring, so a lot of trees are blooming. How do you differentiate between a virus, a bacteria, and allergies? That's a tough call. The one thing I will tell you about bacterias and viruses, symptom-wise, is that you don't have itchy, watery eyes. Itchy, watery eyes are very, very common when it comes to allergies. Okay, so that's number one. You can get a low-grade fever and a cough with allergies, but itchy, watery eyes are very specific for allergies. How do you differentiate between these type of viruses, and what are some of the symptoms? What the most common symptoms, signs that you will have, especially with most viruses, with most flus, if you will, is a low-grade fever. You don't typically get a fever up to 102, 103. You will get a fever of 102, 103 because on top of viruses, when the immune system becomes weakened, you can get what we call co-infections, which are bacterial infections on top of that. When you get those high fevers, you're probably going into some kind of a bacterial infection. So viruses, typically low grade, and you can go up to 101 sometimes. You don't typically go that much higher. You can go into, 102, 103 is very unusual. You will get, you just feel, your joints ache, your body aches, your skin hurts, you have a cough, you have a sore throat. These are some of the typical symptoms that we're starting to see with viruses in general. Now, the one thing that I heard today, that I read today, was that with the COVID-19 virus, people are losing their sense of smell and taste. Now, there's a very, very specific reason for that. The reason for that is because the body is getting completely depleted of zinc. Zinc controls your smell and your taste. So if you are starting to get symptoms of losing smell, losing taste, one of the NBA players said that's one of the first things that happened to him was he lost his sense of smell and taste. Well, the reason for that was that these young guys, are very deficient in zinc. This is why a lot of these ball players are always getting sick. They're always getting the colds and flus. They don't do the simple basic things. They're 20 years old. They think they're not going to get sick, but they do. But that's a zinc deficiency.
Probably over 30% of the population is deficient in zinc. If you could talk about what kind of foods have zinc in it that we should be eating.
Well, the zinc foods that look, most of the vegetables have not only zinc, but they have so many other nutrients. This is why I like vegetables. I call vegetables a pharmacy, a potpourri of nutrients. Specifically, I really like the greens. So there's magnesium, there's iron, there's zinc, there's calcium, so many of those. Those are my favorites. I don't know if you have any favorite zinc vegetables that you like, but I really like the vegetables in general.
Yeah, I mean, pumpkin seeds, a lot of the seeds have zinc. So
Yeah. You're absolutely correct. The seeds, pumpkin seeds, also any of the nuts have good amounts of zinc. They have a lot of not copper, um, zinc, and I'm drawing a blank on the other one. But zinc is found in a lot of the seeds and things like that. Yes, selenium. That's the other thing I was trying to think of. Selenium is another. I just took some selenium. I'm in my home. I took some selenium this morning. I took my vitamin D this morning, and I took a whole bunch of other things to really try to keep myself healthy.
Yeah, I take 200 micrograms of selenium myself per day as an antiviral strategy. Now, I want to ask you a question about fever, since we brought up fever before.
Mm-hmm.
You know, you help bring integrative medicine to mainstream. As you teach residents, and you talk to them about nutrition. It is a little controversial in some areas of integrative medicine that to let somebody have a fever, because that's the best way of fighting illness, because that's the body's way of fighting illness. And then on the other hand as well, we don't want to be uncomfortable. Let's take Tylenol, Advil, or aspirin. Where do you fall on that? And I don't think it's an absolute one way or another, but give us the both sides of the story on that.
Wow. You want to talk about controversy, Dr. Kelb. That is probably one of the most controversial things. And it's really interesting that you said this, that you asked me that question, because, one of the cardiologists called me the other day, and he said to me, he asked me that exact question, because it has been out in it's been out in the public, on Facebook, et cetera, that we should not be drinking liquids, cold liquids. It should be room temperature or heat, because heat kills viruses. All right, I need to take my glasses off for this to answer this question. Here's my feeling. I do personally, okay, I'm going to tell you what I do personally. If I have a low grade fever, and I'm talking low grade, if it goes above 102, you got to do something. Okay, that's serious. But if I'm running 100, 100.4, 100.6, up to, and I will say up to 101, I don't take anything personally, because what I know is happening is that heat, internal heat, is doing something. It's our body's reaction to the infection. So personally, I don't do anything. Here's what I do know. When I finished medical school, right after I finished medical school, I spent a year and a half at CHOP, Children's Hospital of Philadelphia, in the Department of Anesthesia, studying cerebral blood flow. And at the time, this was 1982, 1983. Remember, I don't know if you remember Reye's syndrome. Reye's syndrome, children were dying after they were given aspirin. And what was happening was that it was poisoning the liver, and it was increasing blood flow to the brain, and they were dying because of that. So it was causing a problem. So what I tell people, and there was another study that recently came out from the UK, I believe it was reported in the British Medical Journal, that said that we should not be using non-steroidal anti-inflammatories like ibuprofen for people with fevers. I don't know the exact mechanism of the reason of why they said that, but for me, the non-steroidals, along with things, because they have an aspirin-like effect, may be having the similar effect on increasing blood flow, and they were saying increased viral replication. All right, so the virus was getting worse. Now, that's a lot of information I just gave you, but let me simplify what I just said. Personally, if I have a fever and I don't have any risk factors with seizures or anything like that, now this is different for children, by the way, okay? This is different for children. So I'm talking about adults. If you've got a fever and if you're able to tolerate it up to about 101, personally, I let it go. I let it go. Again, this is very controversial. This is very controversial. Most medical people, MDs like myself, will say, no, you got to treat it. I let it go a little bit longer. Children are different, by the way, all right? Children that have infantile seizures, all bets are off. You got to treat them because they're going to seize if they get fevers, so you have to treat them accordingly. And I personally I tell my patients to use acetaminophen. Again, follow directions. Don't overdo the acetaminophen. Once that goes away, once your seizure goes away, remember, acetaminophen gets cleared through the liver. So you have to be very careful after this is all over to do a liver cleanse also. Schisandra, milk thistle, glutathione, and acetylcysteine, etc.
Just say that one more time for the liver cleanse. What do you do for a liver cleanse?
What I particularly do, and in fact, I'm doing that now. Why is it so important to do something for your liver? Well, remember, for all of you that are not feeling well, you're doing stuff. And the other thing I don't want to forget, Dr. Geld, is to talk about diet. And I know you're going to ask me about that, knowing you. So we'll get to that. But the reason is when you are not feeling well, if you will, there's toxins in your body, there's chemicals your body's producing, there's going through a lot of oxidative stress. There's a lot of waste product that's being produced within your body. You have to get rid of it. And what are the 3 ways you get rid of waste? Number 1, through the airways, right? Breathing it out. Number 2, through your skin, sweating it out. Number 3, passing your water or through your kidneys. And number 4 is your liver. Everybody forgets, everybody says, well, okay, it's good for you to sweat, get in an infrared sauna, make sure you're passing your urine, make sure you're drinking plenty of water. How many people talk about the livers? And then you go through this sequence of, oh, I feel better, and then something else comes along, and now the liver is stressed again. We're changing the oil, but we're not changing the filters. There's no way I'm going to change the oil in my car without changing the filter. And your filter of your body is your liver. So you've got to make sure that you clean and cleanse your liver. And the way you do that are simple things. Dandelion. Why do dandelions grow in your yard in the spring? Because dandelions are used as a liver cleanser. It's a cleaner. Ancient traditional Chinese medicine, Native Americans, they pick those dandelions, they boil them, and they drink the water. Now, I'm not suggesting you do that because God only knows what's on your lawn with all the chemicals you've put on there, all right? But dandelion, milk thistle or silymarin, schisandra, which is my favorite, and acetylcysteine, glutathione. These are all simple liver cleansers.
Can you give us some doses for some of those that you just spoke about?
A lot of these are, what I tell my patients is this. A lot of the dosages are different for so many different products. The simplest way to dose supplements is to follow the directions on the boxes. You yourself said, I take 200 micrograms of selenium every day. Great. And that's probably the directions on your box, is to take 1 of those a day. If it's 100 micrograms, it probably says take 1 or 2 of those a day. You're not going to find a 400 microgram selenium because, the dose is usually around between 2 and 400. So what I tell my patients is follow the directions that are on the boxes because they're dosed accordingly. I hope I'm not oversimplifying that for you.
No, that's great. You mentioned infrared sauna. I actually have one in my house, and I use it every other day or sometimes every day. Talk about how that could be used for detoxification and as an antiviral strategy.
I love infrared saunas. I could kick myself. I mean, kick myself, because somebody offered me an infrared sauna many, many, many years ago. And I said, no, I don't have to put it. And I have room in my house to put it. But it was just a very bad mistake on my part. I love infrared saunas. And the way infrared saunas work, and by the way, you have to be careful with using infrared saunas. If you have high blood pressure, if you have cardiovascular disease, you have to be very, very careful that you don't stay in there for too long. And what's too long? No more than 10 minutes. If you've got heart disease, high blood pressure, heart disease, anything to do with blood flow, where you've got compromised blood flow, you have to be very, very careful, because what it does is that it vasodilates, meaning it opens up all of the blood vessels, and it basically mimics exercise. So you feel like you're exercising, and because of the vasodilation, because of the opening of the blood vessels, that's why you sweat. So sweating, basically, that's what it does. It warms the core, and you start to vasodilate, and and this is why the heat killing the viruses and bacteria, by the way, also, not only viruses, but molds, viruses, bacteria, all get destroyed with infrared saunas.
Dr. Rhonda Patrick, she speaks a lot on infrared sauna and how it cuts the risk of a heart attack by about 50%. She cites these Finnish studies because in Finland, people use saunas all the time. And people that go in sauna 4 or 5 days a week versus 1 day a week or none actually could cut their risk of a heart attack or all-cause mortality by about 50%. And I just always found that fascinating.
Wow. Yeah. I know that there's good data, on saunas. I didn't realize that was that significant. Let me just mention one other thing that I think we have to be very careful with here. We have got to get away, and especially at this time, we have got to get away from our American arrogance when it comes to studies and data, okay? Just because it wasn't done in the United States does not mean that the British, the Germans, the French, the Australians, etc., are not doing good studies. We have to, for example, British Medical Journal or the European Journal of Cancer. I mean, these are great journals. And we hear medical doctors in this country dismiss some of the data, some of the studies that are being done abroad. Please let's not let our medical arrogance get in the way of looking at some of this data and some of the studies that come from other countries, whether it be the COVID virus or data that's being done on that, or saunas from Finland showing that there's decreased mortality in from heart disease by using a sauna.
So let's look at what you're doing for your family and yourself for prevention as we're going through this epidemic, this pandemic.
What I'm doing is, number one, and you've heard me say this, Dr. Gelb, numerous times, is your diet. Look, a lot of people are home. They're trying to be active. They're under a tremendous amount of stress, whether you realize it or not. Well, I'm not going to work. I'm not driving. I'm not under stress. Yes, you are. You know how you're under stress? You're watching the news. Every time you watch the news, your adrenal glands are going bonkers. I mean, bonkers. they're going absolutely crazy. So the amount of cortisol that is released, the amount of oxidative stress is tremendous. And then you come downstairs in your house and you open up a bag of potato chips, right? Or eat a piece of chocolate. That's really not a good idea. You're at home. Use this time to cleanse and clean your body. Intermittent fasting, the benefits, the tremendous benefits of intermittent fasting. What does it do? Simple. Autophagy, or cellular cleaning, lowering insulin levels, increasing growth hormone levels. If you don't know what intermittent fasting is, look it up and do that. That's number one. So your diet, what you're doing, what you're consuming.
How often do you do intermittent fasting, and how do you do it? And I'll tell you how I do it.
What I do with intermittent fasting is typically, I would do it 5 to 6 days a week. I don't do it every day, and I don't do it in any particular cycle. For example, 6 days on, 1 day off, 6 days, no. You have to change it up because you don't ever want your body to get used to a pattern. Because once it gets used to a pattern, that's not a good thing. You've got to make your body and your cells think. So I vary it. Sometimes I'll do it for 5 days. Sometimes I'll do it for 4 days. Sometimes I'll do it for 7 days, but I always change it up. So Monday through Thursday, next time it would be, Sunday to Wednesday, whatever. I mix it up, but I try to do 5 days, minimum 5 days. And I do 16 hours. So I typically fast for 16 hours and eat for 8. So I typically will eat between noon and 8 p.m. or between noon and 9 p.m., depending on my work schedule. All right. That's typically what I do. What about you?
I go to the gym in the morning. And just like you said with intermittent fasting, you don't want your body to get used to it. Just like exercise, you don't want to do the same exercise all the time. You have to change the exercise around. And I agree with you 100%. You have to change the intermittent fasting around. But I eat my last meal when I'm doing intermittent fasting about 4:30, 5 o'clock, and then I'm done. So I'll eat a huge breakfast, after the gym around 9:30, 10 o'clock, a big lunch around 3:30, 4 o'clock, and then I'm done when I'm doing the intermittent fasting. If I have to eat something, it'll be a piece of celery or a carrot or something like that. But typically, it's not going to be anything. And I feel that's also one of the best strategies to lose weight is not to eat late at night. Now, I know I spoke to you about this in the past, and you mentioned that you can't go at night without eating, you personally. Now, so this isn't for everybody, but I feel that for people that can do it, that need to lose weight, this is a good way of doing it.
I agree with you. And you made a very good point, Dr. Gelb, is you have to do what works for you as far as your schedule, right? For me, I typically don't like to work out in the morning. I work out or I play tennis typically in the evening, all right? Because it's just the way my schedule is. So I will play tennis in the evening and I will eat after I come home, but I give myself enough time before I go to sleep, all right? So again, this is very, very personal, and you have to personalize it for you.
So let's talk about diet. What do you think is the best type of diet to eat, or is there a best type of diet?
Well, I don't think that there's, the Mediterranean diet, all the data and all the studies have shown that the Mediterranean diet is by far the best when it comes to metabolism, et cetera. And what is it, right? It's good fats, it's nuts, it's seeds, it's fruits and vegetables, it's a little bit of protein. That's from, in my opinion, that's really the way to go.
So when you're eating and you're eating a Mediterranean diet, how often will you cheat and have a piece of pizza or a piece of cake that's really not healthy for you?
what I practice myself is this. I eat, and I tell my patients this: don't eat like it's your birthday every day. Your birthday is once a year. Eat, look, grandchildren. I mean, you and I both have grandchildren. If it's one of my grandson's birthdays, I'm going to have a little piece of cake. I'm not going to eat the whole cake. I'm going to have a little piece of cake. I have dark chocolate in my home, 75% dark chocolate, but it's a little cube. It's a little teeny cube. And that's what I will have with some almonds if I need to cheat. Will I eat a piece of pizza? Yes. And I can eat a whole pizza easily. I can easily eat a whole
Me too.
pizza. Yeah, no problem. I have a voracious appetite. So eating a pizza for me is not a problem. But if I'm going to have a slice of pizza, I'm going to have a very thin crust, vegetable pizza, and I'm going to limit the amount of cheese that's on my pizza. I'm going to try to get the pizza from a place that's gluten-free because they do have all of these things available. And I don't have a gluten sensitivity, by the way. So again, making choices. Now, if I'm on the road and I'm at an airport and there's really nothing there, the salads look terrible, I'll have a slice of pizza, and I'll do it when I need to.
I think, but in general, we want to eat like a great grandmother ate. And thank you for the compliment, but I'm not a grandparent yet, but hopefully.
Oh, I
someday.
thought you were. No.
That's,
Okay.
no, that's okay. So I really want to talk about antiviral supplements. That's where you're really an expert. You've developed over 300 different products. You have your own line of products. Tell me what antiviral products that you're taking right now. And I'm really fascinated by this. And I'm also very disappointed that the media doesn't mention taking vitamin C or any type of selenium or quercetin or even a multivitamin or anything that we know that could be antiviral. It's really a shame that they don't say, you lock yourself in your house, but take some vitamin C. What's the harm by telling people to do that? But what do you think?
Oh, I completely agree with you, Dr. Gelb. I can't stress this enough. Over the past couple of weeks, since this whole thing has hit, we have been so busy with our supplement business because all of my people innately know that vitamin C is good for you. Why? Well, vitamin C is one of the most potent antioxidants that you can take, and it's way, way, way overlooked. Vitamin C, great idea. My top three.
Let me interrupt for just one
Sure.
second. I'm sorry.
Okay.
I know you're humble, but tell us about your supplements, your supplement products. What supplements have you developed, and what are your supplement products?
Well, I've developed.
So people, our listeners, will know what they are.
I've developed well over probably 400 products right now, and if again, I'm not here to sell supplements. I'm here to give you advice to try to help you get through this whole thing. If you want to get some good supplements, these are things that I personally take, and I'll go over that with you. You can go to www.CSCharlieSam, which CS stands for Common Sense supplements.com. So www.CSCharlieSam supplements.com. So on there, Dr. Gelb, what I have told my patients to do, I have a top three or top four actually. Number one, probiotics. 70% of your immune system resides in your intestine. You want to stay healthy? Take a good probiotic. And we have a great probiotic. Vitamin D. There's very good data. In fact, I need to send this to you. On vitamin D, a friend of mine used to work at the NIH and wrote an article on the role of vitamin D as an antiviral. And how it, not so much an antiviral, but how it kills the influenza virus, how it kills viruses in general. Vitamin D is a very, very potent antiviral, and it works very well. But When you're using vitamin D, you have to make sure that you combine it with vitamin A and vitamin K2 to really get the benefits of the vitamin D. So we have something called ADK, all of those, vitamin A, vitamin D, and vitamin K2 all together. Now, for those of you that remember the old days, right, where we used to use A&D ointment when our children had the little rash on their butt or they had something going on their body, it was A&D ointment. Why? Vitamin A and vitamin D have a synergistic effect, meaning they work together. So I combined vitamin A, vitamin D, and vitamin K2 together, all three together. The third one are omega-3s. Omega-3 fatty acids are really important to activate T cells, to activate the cells and activate our immune function within our body. Now, this is not meant to treat, cure, or diagnose, okay? What I'm telling you is what I do with my patients, what I'm personally doing now, what my sons are doing, what my family's doing, what my mom and dad, all of my loved ones, what all of us are doing right now is taking these immune products. You know, this is a very, very simple, a very important thing that we can all do. Don't forget your vitamin C. Vitamin C, I think, is also a really good idea. Adaptogens. I know you're a fan of adaptogens. These are things like Endographis paniculata, rhodiola. I mentioned Schisandra before for the liver. You know, my entire family, my wife that's here, she takes all of this stuff too. And we have to stay healthy. So, but the top three, probiotics, ADK, and omega-3s. Those are my top three. And in fact, we have an immune bundle that I use in my practice for my patients.
So if we talk about some of the other ones, let's take up vitamin C, for example. As a preventative dose, now, of course, there's nothing guaranteed. What would be the preventative dose of vitamin C that you would recommend? I take 1,000 milligrams 3 times a day, or I take a vitamin C powder, which a teaspoon of the powder is about 5,000 milligrams. I take a half a teaspoon twice a day. So one or two of those. But what do you think? What would your strategy be for vitamin C?
My strategy for vitamin C, what I'm personally doing is, let me see, each one's 1,000. So I do about 6,000 a day. So right around where you are. And remember though, Dr. Gelb, that you and I are with patients, right? We're interacting with people very closely. And goodness gracious, you probably closer than I am when you're doing the eye exams. But I like to I like to be a little bit more aggressive. And then if you start to get ill, if you start to feel sick, you're going to need to go 6,000, 8,000 milligrams a day. Make sure you take it with a little bit of food. But I'm not afraid of vitamin C. I mean, I love it. I love it.
They say to take it to bowel tolerance.
Yes,
Can you
yes.
explain what that means?
Yeah, what that means, take it to bowel tolerance means a lot of times people will start using vitamin C and they'll start to get loose stools. You'll get loose stools, you may have some diarrhea. That's what they mean by bowel tolerance. Once that happens, you need to just back off a little bit. Let's say you were doing 8,000 milligrams a day and you start to get loose stools, you may get a little bit of cramping, and you're doing 8,000, back down to 6,000. And if you can tolerate that dose, continue on that dose, because what that's doing is that it's cleansing and cleaning your system out. Now, folks, listen, Dr. Gelb and I are very much on the same page with this stuff, okay? You go talk to your medical doctor about this, and they're going to say, who told you that? These people are crazy. No. If you look this stuff up, Dr. Linus Pauling won the Nobel Prize in Medicine, not once, twice. That man was not crazy. He is a Nobel Prize laureate that was the biggest proponents of vitamin C. There's a reason for that. The Linus Pauling Institute always talks about vitamin C. This is not craziness. This is just pure logic. And in fact, there's some data that I read, I don't know if you saw this, Dr. Gelb, that vitamin C IV coming out of China to treat some of these folks. In fact, at my office in Florida, I have an office in Naples, Florida. We do IV. There were some IV therapies there, and I did IV vitamin C along with the Myers cocktail and the glutathione push for myself to keep myself healthy.
Now, if somebody wanted to get IV vitamin C in New Jersey, are there places to do it, or in different parts of the country? How do you find where you could do it? Because I know if you go into the hospital and you're on your deathbed and you ask for IV vitamin C, I doubt you're going to get it.
No. New Jersey is a tough state. It's a tough state. I know I don't know anybody here in New Jersey that are doing IV vitamins. I don't know if you do, but in Florida, all over the place, and it works. It just depends on the medical boards here.
Yeah, they're people are a little bit more progressive in Florida.
Well, yeah, and I mean, again, like I said, we're in a pretty conservative state, so I mean, it's okay, but you can do some of this stuff orally. I mean, it's not a problem, but it does work. It does work. And by the way, Dr. Gelb, if anything ever happens to me, you're on consult. I'm telling you that now to treat me, and you have full range to do whatever you want with me. All right, just an FYI, I trust you.
You got it. I'll be there. You don't have to worry. So let's talk about back to vitamin D and getting your vitamin D serum tested. What number would you think is optimal for your vitamin D level?
I'm glad you used the word optimal instead of the word normal. There's a difference between normal and optimal, and you've heard me say this before. There's, Dr. Alan Mintz said normal is a risk factor for disease. Dr. Alan Mintz was the godfather of age management medicine. And I remember hearing him speak, God rest his soul, many, many years ago. And he said, don't ever be normal. Don't ever be normal. You have to be optimal. So I want your vitamin D level between 60 and 80. And there's good data to suggest that once you get in that range, that is where your body really works optimally. So I keep my vitamin D level between 70 and 80.
And so what dose would typically get you there?
Personally, my vitamin D level, my vitamin D dose, I take 10,000 IU per day now. But I check myself. I check myself 2-3 times a year just to make sure I'm not taking too much or I'm not taking enough. A safe dose for those of you that don't check your levels regularly is 5,000 IU a day. All right. So if you have access and you can really check your level a couple of times a year, okay, 10,000. In the summer, I back off to 5,000 because I'm out in the sun. I'm playing tennis. I'm outside a lot. I usually back down to 5,000. If I go to the beach, if I'm at the pool, if I'm outside with the children or my grandchildren, then I don't even take any vitamin D that day in the summer. Winter, when I'm indoors and we're traveling and we're 10,000 IU a day, in the summer I back down. Personally, I back down to 5,000.
I've seen people who take 5,000, 10,000, and they can't get their vitamin D number to budge above 25 or 30. What do you think the reason is that?
Well, there's 2 reasons for that. Number one, they have a genetic defect. There's about 2 or 3% of the population, and I have a whole family, by the way, that has that problem. They can't move their vitamin D level. So I have the entire family on 20,000 IU a day, and they still are in the 40 range. There's another genetic abnormality where if you check their total vitamin D levels, they are low, but their 1-hydroxy levels, 125 hydroxy levels are very high. That is another genetic abnormality. And I had this case, and in fact, I had to send, oh goodness, I'm drawing a blank on this gentleman's name. He's the granddaddy of vitamin D, and he's on all the references. And
Michael Hollick.
Dr. Michael Hollick from Boston. And, we share a couple of patients, and I called Dr. Hollick and I said, I can't get this guy's level up. He went up to Boston to see him, and that's what he had. He had a genetic SNP. He had an abnormality in his DNA that they can't metabolize and utilize vitamin D. And he said, don't worry about it. Don't overdose him. Just try to maintain him where he is and he'll be fine.
And there's been studies that show that putting your vitamin D level above 50 compared to people who have vitamin D levels below 30, you could decrease your risk of getting the flu or a cold by 45-50%.
Oh yeah. Yeah, that's just, it's just a no-brainer. I mean, that's just a no-brainer, especially at this time of the year during cold and flu season. Man, you got to keep those levels up. You've got to keep those levels up. So 10,000 IU, by the way, we have a 5,000 IU, we have a 10,000 IU. And either one, that's the best thing to do.
Let's talk about quercetin. Can you mention about quercetin? I know that there was some effectiveness with quercetin against the SARS-1 virus. And how does that work? And I know a lot of people recommend it for allergies, but how does it work for being an antiviral? And do you recommend it?
I don't use a lot of quercetin. I know you really like quercetin. It is an antiviral. It is an anti-inflammatory, all right? But remember, it has a dual effect. It's not only has an effect on viruses, it has an effect on inflammation. So when we talk about supplements, there is not just one specific thing that they do. This is the beauty of dietary supplements. Let me use another example. Let's talk about omega-3s. What do they do? Or let's go back to probiotics. Well, probiotics, the good bacteria, are good for digestion, good for elimination. It's good for detoxification. It's good for boosting your immune system. It's good to support your immune system, It's good for B vitamin production. So it's not just one thing. It's the combination, it's the group of how these dietary supplements work. Look at omega-3s. Look at all the effects of omega-3s. Look at all the effects of vitamin D. Quercetin is the same way. It has numerous applications to get to the same problem. So not only is it beneficial to help support people with allergies, reducing that whole process, but it also is also very good to help support the health of the immune system, because inflammation or immune function and all of these pieces fit together. And that's where quercetin comes in. But again, I don't use a lot of it. I really don't. I have to be very honest with you. But that being said, it is a phenomenal supplement that I know that you really like, Dr. Gelb.
Talk about what a cytokine storm is and trying to prevent the cytokine storm, because that seems to when people get a very, very bad reaction to COVID-19, that seems to be what kills them.
What's happening there is this. You have, and let me compare it this way. You walk out into your backyard and you're camping. You're in the woods, you're camping. You've lit a little fire. That little fire, if it's controlled, you can cook your breakfast, you can cook your lunch, you can cook your dinner, and it will keep you warm. All of a sudden, what happens is you walk away and you get sloppy. You come back, your tent's on fire. And all of a sudden now, the woods are on fire and it's completely out of control. That's exactly what a cytokine storm is that there is an explosion of inflammation. The word inflamme from the word inflammation comes from the Greek word, which is inflamme, which means to set on fire. When you go into this cytokine storm, what has happened is that your body has just exploded and there is a fire going on in your body. So what's going to happen? This fire is going to shut down your kidneys, it's going to shut down your liver, it's going to shut down your heart, your brain, and you go into what is called ARDS, or acute respiratory distress syndrome. That's what's happening. So we have to do everything we can to prevent this storm from happening. And Dr. Gelb, I'll mention this to you, but I'm going to mention this with a caveat, all right? Just 2 days ago here in New Jersey, so today's the 23rd of March. A couple of days ago, somebody went into the hospital at one of our hospitals locally, and they were in respiratory distress. They were going into ARDS, which is respiratory shutdown, basically. And a friend of mine was called in, and he gave them, you mentioned stem cells before, he gave them intravenous exosomes in the hospital. In 24 hours, the person was better.
Wow.
So, you know, there are new therapies that are out there. There are new things happening out there. In fact, I got the text from him saying, Derrick, guess what I just did. And in the hospital, this person was dying. So there are modalities, there are treatments that we need to open up our minds and open up our brains to that really do work. And if there's nothing else, that's why I said to you, anything ever happens to me, you got carte blanche on me. Do whatever you want, because you never know. There's so many new modalities. Let's not close ourselves off. Let's open up our minds. If nothing else, let's open up our minds to wellness and do all the pieces. Do your diet, do your exercise, go for your walks. Make sure you sleep, right? Sleep, you gotta sleep. Don't stay up till 2 o'clock in the morning watching movies and eating potato chips and drinking sodas. Don't do that. Keep a regular schedule. I went to sleep at 11:15 last night, my usual time, 11:15, and I woke up at 7 o'clock this morning, my usual time. If your body senses that you need more sleep, sleep. Remember, watch animals. If your dog is not feeling well, they don't want to eat and they want to sleep. This is what you need to do. Listen to what your body is telling you to do and be open to all of these modalities that are out there to help you.
Well, I want to thank Dr. DeSilva for joining us today. Dr. DeSilva, if people want to find out more about you, how could they do that?
Oh my goodness, there's all kinds of propaganda about me on the internet, so you can look there. But if you want to get a hold of some of our supplements, again, I mean, look, my whole family uses them. I like them.
I use them.
You use them. I know. It's www.cs, which stands for Common Sense supplements.com. We've got a great little immune pack that you can pick up. But again, do the basics, folks. Do the basics. And thank you for allowing me to mention that, Dr. Gelb. I appreciate that.
And thank you for joining us, Dr. Silva. This is Dr. Kerry Gelb from Open Your Eyes. Until next time, thank you for joining us.